Good afternoon, and thank you for joining us. Today is Tuesday, February 1st, and on today's briefing, we'll hear from Mayor Cavalier Johnson, Milwaukee County Executive David Crowley, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Commissioner Kirsten Johnson, Commissioner of Health with Milwaukee Health Department. Thank you all for being here, and Mayor Johnson, I'll hand things over to you.
Well, good afternoon, everyone. I want to begin by first wishing everyone a happy Lunar New Year. For those who celebrate the Lunar New Year, enjoy safely reuniting with your family, honoring your ancestors, and welcoming good fortune for the year ahead. Today also marks the start of Black History Month. It's a time to recognize, to celebrate, and to honor the rich history, the contributions and achievements of African Americans, not just here in Milwaukee, but across Wisconsin and across the United States. Racial disparities are a part of that history, and I continue to be concerned about the disparities in COVID-19 vaccinations. I want everyone vaccinated, yet we need to appreciate how history affects the trust some have in government health initiatives. I want to reaffirm the city's commitment to ensuring equity and opportunity for all of our residents. I have an exciting opportunity to share with residents today. The Health Department will launch a new COVID-19 vaccine incentive program starting this Thursday, February 3rd. Anyone 5 years of age and older receiving their first dose of a COVID-19 vaccine at any Milwaukee Health Department vaccine clinic will receive a $100 gift card right on site. This includes our Northwest and South Side health centers, as well as our Menominee Valley site. It also includes school-based clinics in partnership with Milwaukee Public Schools and other health department mobile vaccine clinics available throughout the community. There are 1,000 of these $100 gift cards available to residents. Take advantage of this opportunity to protect your health, the health of our community, and earn some extra money. An update now on our gating metrics for the week. We remain in the extreme transmission category for COVID-19 cases per 100,000, down to 400 cases per 100,000. And our percent positivity rate also remains in the extreme transmission category, down to 14.5%. Our vaccination rates, 62.2% of City Milwaukee adults, those are again individuals 16 years of age or older, are fully vaccinated. 67% or 67.6% of adults have received at least one dose, and 42.7% are fully vaccinated with a booster. We're continuing to see a decrease in disease burden in our community, and that's a promising sign. Again, though, I caution residents of our city. Although we're seeing improvement, we still remain in the extreme transmission category and need to continue practicing the appropriate safety measures like wearing a mask, washing our hands, and watching our distance. Not to mention, of course, getting vaccinated. The health department continues its mobile vaccination sites in partnership with Milwaukee Public Schools to provide vaccines to students, staff, and the community throughout the community through the school-based clinics. So far, the health department has administered nearly 550 doses of the vaccine. The full schedule of school-based clinics can be found at milwaukee.gov/COVIDvax. Here's a brief summary of mobile vaccine clinics for this week. Wednesday, February 2nd, that's tomorrow, from 2 to 5 p.m. at La Causa Charter School, 1 to 4 p.m. at Ascension All Saints Family Health Center, 3 to 5 p.m. at COA Golden Center. On Thursday, February 3rd, there will be two. One will be from 3 until 6 p.m. at Fratney Escuela, another from 1 to 4 at Jackson Early Childhood and Elementary. Friday, February 4th, from 2 to 5 p.m. at Starms Discovery School. On Sunday, there'll be a clinic from 12 to 2 at the Burmese Rohingya community of Wisconsin. And then on Monday, February 7th, from 11 a.m. until 1 p.m. at Mount Mary University. as well as an additional one from 1 to 4 at Longfellow School. Vaccines and boosters are always available at the health department's community locations at the Northwest, South Side, and Menominee Valley sites as well. Thank you.
Good afternoon, everyone, and thank you so much for that, Mayor Johnson. And as Mayor Johnson noted, February is Black History Month, and it's a time to recognize, to celebrate, and honor the rich and diverse history and important contributions and achievements of African Americans. And as we honor individuals for their contributions in our community, I want to take a moment to acknowledge the passing of Dr. Lester Carter, one of the longest serving African American pharmacists in our country, but he was also a pillar in our community. I grew up on 23rd in Burleigh, and I remember going to his store and visiting his store, not only to buy chips and candies, but also picking up, just items, pharmacy items in general for my family whenever it was needed. And as many of you know, he passed away yesterday at the age of 90. Dr. Carter served customers in Milwaukee's Amani neighborhood on the corner of 24th and Burleigh since 1968. He has touched thousands of lives and became a trusted resource in this community. And he helped to improve the overall quality of life for community members. And he will be remembered for his service. So we want to thank him for the positive impact that he had and for promoting healthy practices, especially among our African-American community. The Carter Drugstore was the only Black-owned drugstore in Milwaukee. And for African-Americans, it was comforting to have someone who looked like them tending to their medical needs. And when you think about Milwaukee County's vision, is to achieve racial equity by becoming the healthiest county in the state of Wisconsin. And when you look at Dr. Carter, we appreciate his commitment to helping Milwaukee County residents prioritizing their health. And it's leaders like Dr. Carter that will help us dismantle institutional racism and build up policies, practices, and a culture that ensures race no longer predicts health outcomes. And as the mayor said again, February 1 also marks the beginning of the Lunar New Year. And Lunar New Year, also known as Chinese New Year, allows people to put their past behind and look forward to a fresh start. And each Lunar New Year is represented by a cycle of 12 zodiac animals. And this year is the year of the tiger, which is commonly associated with bravery, with courage, and strength. And these are inspirational words that we can all focus on after the challenges that we have faced the last 2 years during this COVID pandemic. So I'd like to switch gears just a little bit to focus on some mask distribution. Milwaukee County is on pace to distribute 200,000 masks this week. 150,000 of these masks will be distributed to Milwaukee County providers such as our senior centers, Journey House, the Milwaukee Adolescent Health Program, Running Rebels, Public Allies, and others. But in addition, the Department of Health and Human Services is preparing to distribute 50,000 masks to the general public. So starting today, until supplies last, you can pick up masks at the Marshall Cox Center, which is located at 1200 West Valete Street, between 8 a.m. and 3 p.m. And so we are anticipating that these supplies will run out before Friday due to the high demand in masks. So we want to recommend everyone to stop by sooner rather than later. So if you're coming to pick up your mask, we ask that you be respectful as well as kind to our staff. We know and understand that there is a high need for high quality masks, and we're doing our best to make them accessible to our community, but we need your cooperation and we need your patience in order to ensure a safe and respectful environment for not only our staff, but for the people that we serve as well. And just lastly, I want to reiterate that the Milwaukee County updated its COVID-19 vaccination policy to include mandatory booster vaccines for employees in high-risk facilities. And to be compliant with this updated mandate, employees, contractors, and volunteers at high-risk facilities who are eligible for the booster shot must receive their dose by this Friday, February 4th, or 21 days after becoming eligible. And mandating booster vaccine doses in high-risk facilities not only protects the health and safety of these individuals, but also those that we serve. And also it helps to enhance the flexibility in managing the effects of COVID-19 on the county workforce. But since this program has started, we've had over 1,126 total employees submit their booster information to comply with the mandate in high-risk facilities and or to participate in the Boost Milwaukee County Incentive Program. And so to that end, as I shared last week, Milwaukee County launched a Boost Milwaukee County. It's a recognition program for employees who have verified COVID-19 vaccinations and received their boosters. So through May 11, 2022, all employees who submit proof of their booster vaccine will be entered into a weekly incentive prize drawings. And just last week, there were 4 winners selected to receive a $250 reward. And so I want to encourage other organizations as well as employers to consider implementing incentive programs that can help move the needle and be that extra push for staff members to get vaccinated as well as get boosted. And so together, when we think about this, we can all play a role in making our community healthier, and we need to make sure that we can recognize that. So I just want to say thank you again for joining us this afternoon. And with that, I'd like to hand it over to Dr. West.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 517 new cases per day and about 5 deaths per day. We are seeing encouraging trends in declining cases, lower positivity, and declining hospitalizations. And while the trends are certainly in the right direction, and we should celebrate that, it's important to remember that the absolute numbers of each of these are still critically high. We have case counts, positivity rates, and hospitalization numbers that would each be record-setting prior to Omicron. Now, to be clear, we are moving in the right direction, but the disease burden in the community remains high. We see that as soon as today, Pfizer is expected to submit its COVID vaccine to the FDA for authorization for ages 6 months to 4 years. Now, if authorized, this could help protect nearly 20 million children that are not currently able to receive the vaccine. A 2-dose series of the vaccine would likely be initially authorized, with a 3rd dose likely for kids aged 2 to 4 to follow in the near future. So we'll certainly learn more about this in the coming days and weeks, and we look forward to reviewing and discussing the safety and efficacy data when that becomes available. In other news, you may have heard about the BA.2 variant. This is an offshoot of the initial Omicron variant that we've been dealing with. And BA.2 is becoming more and more widespread as it begins to outcompete that original Omicron in many parts of Europe as well as Asia. This variant has been detected around the world and in many states, including right here in Wisconsin. So here's what we know and what we don't yet know about BA.2. So first, regarding transmissibility, or the ability of the virus to spread from person to person. Data shows that it's almost certainly more transmissible than that original Omicron strain, about 1.5 times more transmissible. And that's really saying something considering what we've seen from Omicron and its ability to spread. And that contagiousness is demonstrated as BA.2 has or is rapidly becoming the dominant variant in many countries around the world. Now, next, as for severity, preliminary data out of countries that have seen a lot of BA.2 suggests that it's similar to the original Omicron variant, that is less severe than Delta. But of course, we remember that even when the variant is less severe, that heightened transmissibility can lead to greater overall impact. So when we think of what that impact may be, we want to consider our third characteristic, which is immune evasion. So does the vaccine or previous infection protect against this variant? Early data suggests that the vaccine, especially when combined with the booster, and that's key, provides a high level of protection, about 70% protection against symptomatic illness. And that's even higher than we had with the original Omicron strain. And that benefit of vaccination is likely much higher than 70% in preventing hospitalization and death, much as we've seen with Omicron. Now, the protective effect from previous infection, or natural immunity as some call it, that remains unclear and continues to be studied. Now, of note, the variant is still detectable on PCR and rapid tests. There was some confusion over it being labeled a stealth variant. It's called a stealth variant only because it's harder to sequence than other variants. It still can be sequenced, you just have to use a different method. It is not called that due to difficulty in detecting on that individual level through testing. Now, when we look around the world, Denmark is an important example, as over 80% of their cases are now BA.2. And they've not seen a decline in cases, hospitalizations, or death, but rather, unfortunately, they continue to see an increase in numbers across all 3 of those categories. Now, meanwhile, next door, the UK, along with growing BA.2 numbers, have seen their descent from Omicron pause, with a flat line at the moment in case counts, no longer a descent. Now, that's not to say that either of those is the trajectory we'll see, but it is to say that we should remain cautious and prepare for a decline from Omicron, a decline to be sure, but one that's not as quick as many of us may have hoped. And you certainly continue to learn more and share more about the BA.2 variant in the coming weeks. But I think the take-home point here is that we need to remain cautious. We're seeing cases and hospitalizations begin to fall and fall significantly, but we're not quite out of the woods yet. We remain with high case counts, crowded hospitals, and we have this new variant that may complicate our recovery and our trajectory as we trend down from Omicron. So the single best thing you can do now really is to ensure that you're vaccinated, and importantly, to make sure you're boosted. So in Milwaukee County, 44% of our population is eligible for the booster, but has not yet received it, 44%. And this is a critical step to protect yourself and those around you. So go out, get vaccinated if you haven't yet. And if you have, take the final step, get boosted. Thank you and stay safe. And I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. The gating metrics Mayor Johnson shared are encouraging. We've continued to see the burn rate trend downward every week, but it doesn't mean we can be careless with our mitigation strategies. We currently remain in the extreme transmission category, and we would all like to see these numbers continue to decrease. To continue this downward trend, we must be diligent about following the current mask ordinance and keeping our nose and mouth fully covered while in public. We must continue to practice physical distancing and avoid large indoor gatherings. We must be strict about staying home and getting tested if you're experiencing symptoms so we can slow down the spread. And most importantly, we must all get vaccinated and boosted and encourage those in our lives to make the life-saving decision to get their COVID-19 vaccine. It's heartbreaking to continue to receive the list of Milwaukeeans who have lost their lives to this virus when the vaccine is free and readily available. I know we are all ready for the day when COVID-19 doesn't dictate the decisions we make for ourselves and our families, but the only way to get there is through vaccination. That's why the City of Milwaukee Health Department is implementing this new vaccine incentive program. Only 56.5% of Milwaukeeans 5 years and older have received at least one dose of that vaccine. That means there's still over 250,000 eligible Milwaukeeans who are unvaccinated. I hope this incentive encourages those who are on the fence to make the life-saving decision to get vaccinated as soon as possible. Whether you come to one of our health centers, one of the Milwaukee Public School vaccine clinics, or any of our other mobile community clinics, we'll have vaccines and $100 gift cards ready for you. The full list of upcoming clinics is available at milwaukee.gov/COVIDvax. Please make the decision for yourself, for your loved ones, and for your community to get vaccinated. That's the only way we can overcome this virus is together. Thank you.
Thank you, Commissioner. All right, we will move into the media Q&A portion of our briefing. I'm seeing a few questions coming through. The first one is from Chuck Kornbach with WUWM for Dr. Weston. He's wondering if you can please clarify what % of Milwaukee County residents eligible for the booster have been boosted.
Yeah, absolutely. So when we look at just populations that are eligible for the booster, we see that about 56% of people have been boosted, which leaves about 44% not yet boosted. And we do see that trend moving along age groups similar to how the vaccine does. So when you look at population 65 and older, it's 76% have been boosted. That's the most critical age group since it's the most vulnerable age group. And that drops down to the younger ages between 20 and 30%. We also see from an equity standpoint, differences among races and ethnicities. So our white population, about 65% of the eligible population has been boosted, has received the booster. African-American population, it drops down to about 47%. And then our Hispanic population is about 39%. So we certainly have room to go in protecting our population, boosting our population, and continuing our equity-focused approach to vaccination and boosters.
Thank you, Dr. Weston. A few questions here from Kristen Barbarazzi with CBS 58. The first one is for County Executive Crowley. She's wondering, are there any plans for a county mask mandate?
Great question. So Milwaukee County, we've always had a mask mandate when it comes down to Milwaukee County buildings. When you think about transportation, airports, so on and so forth. But when it comes down to a countywide mask mandate for public settings, we do not have the authority to do that because we don't have a public health department. But we're going to continue to do all that we can do when it comes down to making sure to provide masks to the general public. It was something that we've been doing for the past year and a half, but now with high quality masks as well. But again, we will continue to have that mask mandate in all Milwaukee County buildings.
Thank you, County Executive. The next portion of her question is for Mayor Johnson and Commissioner Johnson. She's wondering, are there any plans to change the timeline for the Milwaukee mask mandate, either extend it or end it early if numbers continue to trend downward?
Well, thank you for the question. When the mask mandate was signed, when I did sign it and gave the COVID briefing soon thereafter, I had mentioned, I think very clearly there that the mask mandate could be ended early. And it would take action from the Common Council to do that. There could be a vote and a council meeting, a special meeting if one were called to end the mask mandate early if conditions warrant it, if we continue to see the numbers going down. So I think that members of the Common Council also are paying very close attention to what's happening in terms of our burdens in this community. And I would encourage them to keep an eye on that. And if the conditions warrant, get legislation over to me to review to possibly end it early. I don't know if the commissioner has anything else to add.
I think you said it well, Mayor.
Well, Commissioner, you can stay on. The next question is for you from Kristen. She's wondering, with the news that Pfizer is seeking approval for vaccines for kids under 5, what steps will the city take to prepare to distribute vaccines to that population?
That's a really good question. So as we prepared for children ages 5 to 11, a very similar process internally, we have our staff, our nursing staff and our vaccinator staff get retrained in how to work with the pediatric population. And then we plan to have it available at all of our sites as soon as it's been authorized by the FDA and the CDC.
Commissioner, the next question is for you as well from Ben Wagner with WISN 12. He's wondering, on the vaccine incentive program, from where are the funds for these gift cards coming? How long do you expect these gift cards to last? And how do programs like this make a significant impact on our vaccine rate?
Sure. So the money comes from a grant and revenue dollars that are generated through our testing program through DHS. We expect these gift cards to last. The last time we did this, they lasted, I want to say 4 days. So probably about 4 days again. And these programs do make an impact on individuals who maybe were reluctant to get tested or to get vaccinated previously. So the last time we did this, we had 1,000 people come who were unlikely to get vaccinated previously, and that was enough for them to be able to take the time to get vaccinated, or enough incentive for them to feel encouraged to get it. And we're hopeful that that occurs again.
Thank you. The last question I'm seeing in the chat is for Dr. Weston from Spectrum News. They're wondering, how do you think the Omicron surge will help the country prepare for a potential surge from a new variant that is just as transmissible, such as BA2?
Well, first of all, to be clear, I don't think BA2 will necessarily cause another surge, but I think the question is important. If we have another variant, which inevitably, considering the lack of global vaccine equity that we're seeing, I think another variant is very likely. And how would we as a community deal with that, and how has Omicron prepared us? I think one way that it's prepared us is through heightened immunity, whether that's vaccine-induced immunity and potentially infection-associated immunity or natural immunity, as some calls it. Now, for the latter category, infection-associated immunity, it's unclear what role that plays now, and it's especially unclear what role that will play in the future. We saw Omicron, for example, didn't much care whether you had been infected with Alpha or Delta in the past. As far as vaccine-induced immunity, I think Omicron has shown us once again, as every variant has, the power of the vaccine. We saw that with Omicron, people who were vaccinated were more than 20 times less likely to be hospitalized with COVID. So we see an incredibly safe and incredibly effective vaccine. And I think Omicron has only emphasized the importance of that vaccine. So hopefully we'll see more and more people taking that step and protecting themselves and their families and getting vaccinated. I think also our community, but also nationally, there's been more steps put in place that can help us respond to surges in the pandemic, whether it's mask distribution, testing distribution, things of that sort. And then finally, one optimistic item on the horizon are new therapeutics. such as Paxlovid from Pfizer is a new therapeutic that it's oral, it's easy to take. Hopefully we'll see it more widely available in the near future that can, add to the vaccine and the level of protectiveness when people do have breakthrough infections, particularly people who are high vulnerability. So I think we've learned a lot from the Omicron surge, but to your point, new variants will come and we should be prepared.
One additional question in the chat from Chuck Kornbach with WUWM for the City of Milwaukee officials. He's wondering what prompts the vaccine incentive now as opposed to earlier?
Sure. So we had always planned to do multiple incentives. When we started them, I believe it was the end of the summer last year. We had discussed internally how we would roll them out. I think the impetus this time was that we had the funding, so there was funding to pay for it, but in addition, the capacity with our staff to do it. So, when we were so overwhelmed with the testing demand, there just isn't capacity, and knowing now, right now, at this point in time, we need more people to get vaccinated. And we have a partnership with MPS. We just thought the timing was good to offer an incentive.
Thank you, Commissioner. Those are all the questions I'm seeing in the chat. So thank you all for joining, and we'll be here next week. Take care.
Thanks, everyone.
Thanks, everyone.